I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh. It's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Welcome to the Hormone Genius. Today, Jamie and I are going to be talking about the hormone estrogen, the good and the bad of estrogen. But we're going to focus on estrogen when it gets a little too much, a little out of balance. And that's something referred to as estrogen dominance. And if you were wondering, could I have estrogen dominance? Well, there might be some symptoms that you could have in relationship to having too much estrogen. And we're going to go through those. We're going to also talk about how maybe you can fix that and get more balance. So Jamie's going to start us off today. Jamie, I guess let's just talk about what are the symptoms of having too much estrogen or being dominant in estrogen?
Yeah. So just as a reminder to our listeners, estrogen is a wonderful hormone. It's a dominant hormone before ovulation. And then after ovulation, progesterone should be our dominant hormone. So when we say estrogen dominance, there's really two main ways that a woman can be estrogen dominant, and we'll get into that. But some signs that you may be estrogen dominant, and this is what I've been noticing, Teresa, mostly about my own health, I'd say the last couple years. I'm noticing more of this, definitely. But if you are having really heavy bleeding, heavier painful periods, and again, we always want to say if your periods are disrupting your life in a very significant way, always make sure you get help. Always, always, because of course there are things like endometriosis that we don't want to we don't want to ignore that. So make sure you get help if you do have heavier painful periods. But one reason, again, you may be experiencing heavier painful periods is because you may be experiencing estrogen dominance from the cycle before. I always like to think, and we say this a lot in our episodes, Teresa, about how the period really marks the end of a sentence. So if we think about the cycle prior as being a sentence, the period really marks the end of it. So our period is like a diary of the cycle prior. So it's giving us data and information about the cycle we just had. So we'll kind of dig more into that. If you're experiencing really low mood, fatigue, anxiety, or even mood swings, one big one could be, again, breast tenderness. So I just mentioned how the period a few moments ago marks the end of your cycle sentence, right? But often when we are experiencing estrogen dominance, it's happening during the luteal phase. And again, we'll dig more into that, but it's when our estrogen levels are dominant over progesterone. So even if both levels are low, if estrogen is dominant over progesterone, and it shouldn't be that way, it needs to be inverted, it should be flipped, then we're going to notice symptoms like breast tenderness. Like right now, it's kind of weird, Teresa, but you see me even touching my breasts because currently I am experiencing breast tenderness. I'm in my luteal phase. I'm day 26. My period will pop up at any point. Again, like I said, fatigue, weight gain, difficulty losing weight, and even trouble sleeping. So if you fall into any of these symptoms, you may be estrogen dominant. So with that list of symptoms, Teresa, what would you say as a medical professional, how does one know for sure they're estrogen dominant? What kind of blood tests do you run? What kind of questions are you asking besides even maybe the symptoms questions to your patients when you're meeting with them during an appointment?
Yeah, well, I think you gave a good summary of some of the symptoms, Jamie. I think you could say a lot of these we classify as PMS symptoms. If we just run through the list of PMS symptoms, if you've got a lot of bad PMS, that could mean you have estrogen dominance. Doesn't necessarily have to be. But I mean, a couple of other medical things too, Jamie, and I want to bring up that the heavy period. So when we think about estrogen is a grower of tissue. progesterone is a balancer or a kind of keep the tissue from growing. So it does the opposite. So that's why, like you said, there has to be this beautiful balance between the two. Otherwise, the estrogen makes it your lining of your uterus overgrow. And that's what causes the heavy periods. Estrogen makes people have headaches sometimes, so migraines. If you have been told maybe you have ovarian cysts and you've had multiple ovarian cysts, that could be a sign of high estrogen too. Fibroids are those little benign tumors. We've talked about that on an episode. That could be a sign that maybe you have estrogen dominance. And then even, like if someone had estrogen dominance for a very, very long time, that could put them at risk for breast cancer and actually uterine cancer. So those are just some more of the medical things that are seen with estrogen dominance. But how would we know? Well, it's kind of simple, there's lots of ways, of course, in hormone areas to test for hormones, and you'll hear people testing different ways, but we're just going to focus on probably just serum blood tests. It's effective, it's cheap, it's available at your doctor's office. So that's what I use. And generally, if I want to know if someone's estrogen dominance, the easiest way is to take their, cycle, ask them to identify the main point of ovulation, and to come in about 6 to 7 days after ovulation. That's what we call the top of the luteal roller coaster. And that's when your estrogen and your progesterone is supposed to be its most generous at that point. It's also where, like, if someone conceives a pregnancy is where the implantation a lot of times is happening around that point too. So that makes sense that the hormone should be the most generous about a week after ovulation. So I just want a snapshot, and I want to say, hey, you've got all these symptoms, kind of sounds like estrogen dominance, but let's see, because we never know for sure. And so we'll have them come in and do a blood test. Well, what would the numbers look like if someone has estrogen dominance? Generally, about a week after ovulation, estrogen sits about between 90 to 120. I believe it's in picograms per milliliter. And so 90 to 120. Now, again, there's a little bigger range that might be okay. Like we call that the standard deviation. But let's just say 90 to 120. So if you have an estrogen level of 260, that's pretty high, right? That's almost double what then the average is. For people who wondering about progesterone, what's the average about a week after ovulation? It's about 13 to 15 nanograms per, I think it's deciliter. So 13 to 15 for progesterone. And so we're just kind of getting a ballpark look at those levels. Now you could do multiple levels. You could do like one on 3 days after ovulation, 1 5 days after ovulation, 7 days and 9 days. That would be like a complete kind of look at the whole cycle. Definitely gives a lot of information. But again, a lot of times we can just do the snapshot. And if someone has a level of 260, we might then put that and correlate it with her symptoms of breast tenderness, major PMS, feeling bloated, feeling really puffy and fluid retention, and realize that they might have estrogen dominance.
Yeah. And how serious of an issue, Teresa, is estrogen dominance? So if somebody's like, yeah, I know I'm a woman though, and I have these symptoms and they're annoying, and sure I have PMS, and sure I'm kind of moody, but I mean, who cares? I mean, someone should care. Someone should fight for themselves. Yes, ladies, fight for yourself. But maybe you don't feel that urgency. I guess, how urgent of a matter in your experience is estrogen dominance, along with like how common is estrogen dominance? Do most women experience this, even at some point in their life? What would you say?
It's interesting. I feel like estrogen dominance isn't as common as some other hormonal deficiencies and issues with hormones. I wouldn't call it the more common one. I think low progesterone and even low estrogen is probably more common. However, I mean, we do see it quite a bit. Why should someone care about? I mean, it's not like urgent. I wouldn't look at estrogen dominance as like a medical emergency. Let's put it that way. However, I mean, we know that balance of hormones is important for our overall health long term. But it really is more about, I think, two things I often focus on with people kind of trying to decide, should I do anything about this or should I test for this?
Yeah.
Is your quality of life healthy and happy? And if not, and these symptoms that you're having are affecting your quality of life, it's definitely worth looking into. Because if I could tell you, we can make this better.
Yeah.
because maybe you're thinking, well, there's just nothing I can do. Well, no, there is. And also, is it affecting your fertility? And that's another thing that we didn't mention as a symptom, Jamie. But
Mhm.
if people are out there and they're trying to achieve pregnancy and they're not having luck, then fertility is an incredible motivator to want to balance your hormones correctly.
Right.
So, quality of life, fertility issues, and then just thinking, yeah, I mean, maybe you have some cancers in your family, or maybe some health issues in your family that you're like, gosh, I don't want to have what my grandparents had, and
Mhm.
my parents are struggling. So there is this reality that the more healthy our hormones are, the better our long-term health will be as well. And that's an important thing to consider too.
Yeah, definitely. Yeah, definitely. And I think a lot about just again, my own health and how, sometimes it's a quandary. Like, even though I feel like I'm doing everything right, I'm getting enough sleep, I'm drinking enough water, I feel like I'm eating good foods, why might somebody still experience maybe some of these symptoms? And let's say they really do, they have estrogen dominance. What I want to go through, Teresa, is I want to talk to our listeners about the liver and the gut and their role with estrogen detox and metabolism and elimination. And I think that will help give some, like, empower these women to even do things at home that they may not have thought to do. And again, what's so nice about charting is not only charting your cycle, like your biomarkers. Of course, you want to chart your biomarkers. When I say markers, I mean your period. So was your period heavy, moderate, light? Using a charting tool like FEM, or meeting with a Creighton practitioner or Marquette, or what have you. That's very important so that you can measure your lifestyle adjustments from cycle to cycle. Is this moving the needle? So making sure you do that. Of course, tracking your cervical fluid mid-cycle, but also tracking your symptoms. Track your symptoms as Fiat Institute. One of the things that, like, one of our big pillars when we're working with a client is we ask them, what are your three main pain points? And over the course of 2 or 3 months, we're going to help move the needle but we're using the chart to manage and measure progress. And we're rating our symptoms on a scale of 1 to 3. And so we introduce something, and then we ask the woman to really pay attention to the symptoms. So that's an invite to you listeners. Like, again, download FEM, read your body app, whatever, and keep track of the symptoms you're experiencing, especially if you're going to introduce some of these kind of strategies to help you. So with that, Teresa, I'm going to talk a little bit about the liver. Okay, so liver is the second largest organ in our body because our skin is the first largest organ. It's our heaviest organ, has over 500 functions. The liver, like, sounds like, could it have been called maybe a different word? Just liver, like liver
Oh,
and
it
onions.
always makes me think of that horror movie. What was that one with,
Mm.
where the serial killer eats the liver and they
Oh,
calls it like fava beans. He eats it with fava beans and he's a serial killer. Silence of the Lambs.
oh, I have not seen. I mean, I know the actor in it, but I've never seen that
Yeah.
movie.
I don't think I have either, but I don't
Oh
think
my gosh.
I hate horror movies, but like, I don't know. That's what I think of when I think of the liver. Is That's weird, isn't it?
Uh, no, I think it's perfect because people who've watched it totally know. And what's interesting also about the liver is my mom, she's so sweet and she loves liver and onions. My mom does. And so for Mother's Day, guess what I gave her? I gave her some liver, like from a
Um,
cow. We bought a cow and there was some liver, so I gave it to her. So that's a little side note. Okay. So if you really want to tell your mother you love her, give her some liver. All right. So here's the deal. The liver is a really important organ. And lately I've been hearing, like, the phrase congested liver. Congested liver. What does that mean? It's like our liver is being overworked. So, a little overview of what the liver does and why it's important for estrogen detox and just for any sort of detox. But phase one, so there's three different phases that the liver works through when it's detoxing, like breaking down toxins, as hormones, so that it can, like, package it up and then move it on out. So the first step is it's breaking it down. So liver enzymes turn estrogen into smaller pieces, just breaking it down. I think you've used this analogy before, like a built Lego thing, and you're taking apart all the blocks. Phase two is it's packaging it up for removal. So, what's interesting is I won't get super into it, not because I don't want to, but because I want to understand it in a really great way. I'm going to keep it high level. But it's like when you're packaging it up into small little pieces, it needs to be packaged up so it can be eliminated. And there's certain things that are important for the estrogen to be packaged with. So, glucuronidation is when you add a sugar molecule to estrogen, so it can leave the body through bile or urine. So it's attached to something. So this estrogen that needs to be eliminated attaches to something, and then we can eliminate it. Sulfation is when sulfur's added to estrogen and it makes it water soluble, so we can excrete it. And then methylation, which hopefully sometime soon we'll do an episode all about methylation, is where a molecule called a methyl group is added to estrogen to neutralize it. And again, that's kind of really digging deep, and we're not even going to go too much into that, Teresa, unless you want to. But if
That's really smart, girl. I was like, good, you go. Like that's good liver stuff you just talked
oh,
about. Good job.
thank you. Well, I had to keep it.
I also have Jamie a super great analogy that I learned
Okay,
on TikTok. So
okay,
I want to
do
give
it.
you because I think you love analogies so
Okay,
much.
I love analogies.
And then after that, we've got a shout out to our
Here,
sponsors. But I want to
yes.
tell you this because you're gonna love this analogy. But
Yeah.
I saw on TikTok that like the liver is like a bathtub. And
Okay.
if you think of, and at first it kind of confused me, but I'm like, I think I get this. Like the bathtub. So like if you think of the water coming into the bathtub, it's kind of like the water is like our mouth and like the what's going in, right?
Okay.
And you can think of the congestion almost as like overfilling the bathtub. But
Yeah.
that the liver, obviously the bathtub that right before your bile and your gallbladder is like the drain, and that's the processing part. But if that part gets all clogged up, it's like hair in your drain,
Oh,
getting
yeah.
congested in there, and so it's not like processing and getting that what you're talking about, that whole phase two detox happening. And then the pipe that goes out of your house is like all
Mm.
your intestines.
Hmm.
So like the pipe is the whole rest of it. So it is kind of like, I always think of our body as like one long tube, and the liver is like this great stop where you need to make sure that whatever's going in there, it holds it for a while, processes all that, and make sure that it's eliminating the right things and keeping the good things.
Yes.
So I thought that was a good analogy, the bathtub analogy for the liver.
That's a really good analogy because I think, I've heard before when, people say, oh, when people say you have an overtaxed liver, that's bunk. That's not true. People are saying that, but the liver can do a lot. And that's just a fad, people are saying. But but the more we exercise a muscle, and the liver is not a muscle, it's an organ, but the more we use an organ, of course we're going to wear it out. That's how we age. You know what I mean? Like our cells start to shut down and we age, and then we die when it's time. So I mean, I think there's an aging process to our organs, and we want to try to take care of our organs so that the organs can do good work for us as we get older. And again, I think some of that maybe has to do with why some women, even in menopause or perimenopause, you're still cycling, but it's getting a little less regular, into menopause, still may be experiencing estrogen dominance. It's because our liver is an organ, and so are our heart and our lungs and all these things that age. So we really want to take care of them just like we would take care of an aging parent. We want to think about we could take care of our aging organs. You know what I mean? But some things that I want to mention. So the reason we need to care about this, especially as we age, is because we can assault our organs. We can like abuse them in a way. That sounds really, but assault them. And the liver can get overwhelmed. How does the liver get overwhelmed? Well, if we have estrogen dominance, and again, we're having these symptoms, and we want to make sure we're eliminating toxins and eliminating hormones properly. But if we're drinking lots of alcohol and we're noticing estrogen dominance, well, alcohol definitely affects our estrogen dominance, or it affects our estrogen metabolization. Processed foods, anything that causes our liver to work extra is going to cause an inability to properly eliminate estrogen or to even process it, metabolize it, break it down. If you're low in vitamin B, like the B vitamins, That's so important. Like again, with the whole methylation, we'll do an episode on that later on. But what I've been doing, Teresa, just as I've realized and known, like I just feel like my estrogen levels are much higher than they used to be. And thanks to my Aneto monitor, I know for sure because I'm measuring that. But just it pairs with my symptoms. But I'm taking more B vitamins. I'm being very diligent about it. Magnesium, take that. Use magnesium, it's very good. And then zinc and choline. So again, if you think that you have estrogen dominance, you could talk to your doctor, but think about what's your lifestyle. Do you have high toxic food, processed foods, alcohol? But then also think about inviting a B vitamin into your home. Magnesium glycinate, which we're going to give a shout out to our podcast partner. Zinc and choline, again, are awesome supplements to try and to track symptoms as it relates to your cycle. Okay, so with that, and then I'm going to punt it over to you, Teresa. We want to give a shout out to We Heart Nutrition. So I love their, again, we talk about it all the time, but literally, ladies, magnesium glycinate is important for most women everywhere. If you are stressed, if you have a job, if you have a family, if you are alive, which you all are because you're listening to this, we need something to help us become more resilient with stress. Anytime we're stressed, magnesium levels are depleted. And we need to restore magnesium because often we're not getting enough of it in our food. We need magnesium glycinate. And our podcast partner, We Heart Nutrition, offers magnesium glycinate that Teresa and I take daily. It's very, very important. They also have a hormone support supplement that I also take daily, and it has the B vitamins in it. It has turmeric, saffron, it has zinc, and I love it. And if you guys are needing good quality supplements that will help your hormones, please visit weheartnutrition.com. You will get 20% off of your order by entering the code GENIUS at checkout. Okay. With that, Teresa, I've been talking for a while. What are some other ways, Teresa, when you're working with a gal and maybe you're running like enzyme, like you're getting a good sense of like labs to test for the health of the liver, what kind of labs do you run to check liver health?
Yeah, that's a great question. Yeah, well, in a metabolic panel, a CMP is what it's called. You get a ton of information about the liver. There's multiple liver enzymes that are tested in a metabolic panel, so we can at least kind of from a acute standpoint make sure the liver isn't super taxed. And most people's livers aren't at the place where the liver enzymes are way high. But if they were, that would be like fire alarm, Oh, yeah. But like you mentioned, Jamie, like all of these nutrient deficiencies, like so many of those can be tested in your regular doctor's office. You can get a B12 level, you can get a folate level, you can get a vitamin D, you can get a magnesium RBC level, you can get a zinc RBC level, you can get an iodine level, so there's a lot of like nutrients that I like to test for in helping know kind of where we can really supplement, to help the body process these hormones better. But yeah, liver enzymes, some of them are the AST, the ALT, the ALK-Phos. Those are like the three big ones. You can also run a GGT. These are all kind of like, basically like enzymes that tell us how hard the liver is having to work. One thing, Jamie, I was thinking of, but we didn't talk about yet, and you mentioned the ultra processed foods kind of like making the liver congested or like having problems. Because I often think, well, why is that happening? Well, it's diverting its attention. Like when the liver has to divert its attention to alcohol, which is, a toxin to the liver, or to chemicals that are coming through the food, it can't work on just the normal stuff, the normal bodily processes. And we have so many things now that we didn't have. So often you can just look at like menstrual cycles in general, like young women on average have started their periods, like I think at least 2.5 years in the last like 50 or 100 years earlier than they did 100 years ago. So girls are starting now, unfortunately, periods on average, around 10 to 11. It's, it's getting earlier. And that tells us that, we are kind of putting too many things into the body that are, causing our livers in a sense to be diverting its attention and causing these imbalance of hormones. But often, Jamie, we think of also xenoestrogens, right? And we did a really great episode on endocrine system disruptors You can go back and listen to that one. We won't, kind of go into a deep dive there. But if you're drinking out of plastic water bottles, if your water isn't clean, if you are eating a lot of meat that comes from just the regular store or dairy, you might be getting more hormones and growth hormone that is injected into those animals, into that meat. And it's so frustrating because you're like, it shouldn't have to be that way. And then it frustrates me because you're like, well, I mean, do I have to spend like millions of dollars to get all this super expensive stuff that isn't injected with that crap?
I know.
It makes me so angry to think
So
about the fact that
frustrating.
we are creating for these poor little girls, getting these hormones too early, and we're starting our periods early, and you're thinking, why?
Hmm.
But the reality is that is what is going on. And then, our hair products, the phthalates, the BPAs, the, PCBs, all of these chemicals that are in plastics and products that are pliable and that we use every day, they are not normal to the world.
Right.
We created them as man, and now we're kind of reaping the negative effects of all of these different chemicals. And really, again, it comes down to the liver looking at these things and being like, yeah, I don't know what this is. It kind of looks like a hormone, but I'm not sure. And so
Yeah.
it's like filtering it through our bodies. And then our bodies are like, well, again, I have receptor sites for hormones. Should I use this? Should I
Hmm.
attach with it? I
Right.
mean, it's got to be mass confusion,
Totally.
in the body from a cellular level. And this is where then I'm in a rabbit hole so deep that my brain is like, oh, forget it. Just
Yeah.
don't do it. You know what I mean? You get kind of
Hmm.
overwhelmed. So don't get overwhelmed. I got myself just overwhelmed for a moment there. And we're going to backtrack. And I'm going to tell you that we can help you and fix the
Yes.
problem. But, so what do? You try as best you can to eliminate some of those things. And then we try to help the liver process these
Right.
things better.
Mhm.
So that gets us to the gut, Jamie, I think, because like
Mhm.
if we want the liver, to work well, we're going to help and give it some love, but we also got to make sure the gut, which is going
Yeah.
to process into, from the liver to the gut, like we got to get that stuff that's bad out. How do we do that?
Yes, yes. I do have to say one thing what you were saying, and I just kept thinking about how our liver, like you're saying, it's stunned. Our liver is stunned, and our gut is stunned. Our system is stunned because our body wasn't built to process the things that it's needing to process now. Our body is confused. So I think about just to kind of tie a loop, and I forgot to say this earlier with the liver. Think about how people used to live. What do they used to do? Like, what did they used to eat? And the liver was made for that. So they would eat, from their gardens. So, like, their broccoli and their cauliflower and their Brussels sprouts and their kale. Although I learned that kale used to be used as a garnish, it was never actually eaten ever. Pizza Hut was famous by using kale just as like the surround in their salad bar. And then there was
Oh,
seriously,
yeah.
isn't this funny? Like nobody ever used to eat kale. And then there was like a kale, like a mission on kale. Something happened. They did an experiment and now it's like a healthy food. But it is a healthy food, but it never ever used to be eaten. That's just a little side note. So what did people used to do? We used to eat from the earth and that would help our liver. Um, Bitters help our liver. So that is like the kale or the arugula, milk thistle, dandelion root tea.
Yeah.
They'd eat enough protein, they'd get their B vitamins through that. They drink plenty of water, so they stay alive. So just for the pure sake of just surviving on with the earth, that's what our liver has been used to for hundreds and thousands of years. Okay, so the gut. So we'll talk about how the gut and estrogen are connected, and there's something called the estrobolome, and it's a group of gut bacteria that help eliminate estrogen. So you think about the microbiome. Well, there's something called the estrobolome. Again, that's the name of the gut bacteria that help to eliminate it. So when our gut is imbalanced, and that's called gut dysbiosis, it's just an imbalance of our good versus bad bacteria. Sometimes what happens is there's too much of an enzyme in the gut called beta-glucuronidase. Beta-glucuronidase. So if you remember what I just said about the liver in phase two, when the liver is packaging up the estrogen for removal, glucuronidation sounds a lot like beta-glucuronidase. And again, that's when the sugar molecule is added to the estrogen, so it can leave the body. So beta-glucuronidase is the enzyme in the body that unpack. So if there's too much of beta-glucuronidase, it can unpackage the estrogen that was packaged by the liver to be eliminated, and it can send estrogen back into the body. So it sends it back up for circulation. So that can also lead to estrogen dominance. So causes of that are poor gut health, constipation if you're not eliminating your bowels, high sugar, low fiber diet. You want to increase that fiber because again, fiber is good for bowel movements, but fiber is also a prebiotic to the healthy gut bacteria. So you're help feeding the good bacteria with fiber. Antibiotic use, like maybe if you're not taking a good probiotic. Again, the probiotic, prebiotic is really important. Um, so that is called beta-glucuronidase. You can get this tested, I know, like with the GI test. And I like if you were to go to Genova gut testing, whatnot. But as a medical professional, Teresa, how do you guys check stool? Because I know there's all these like outside testing places, but how does a nurse practitioner or doctor do this work in terms of checking that?
I mean, we don't.
Okay.
We don't.
Yeah.
There's not, I mean, like from an insurance covered standpoint, there's not a lot of good tests. Like you can test for like the most basic parasites. I can do a PCR test for gut health in a sense and find like some pretty bad things if someone's got super bad diarrhea and a virus or something. But what you're talking about, Jamie, in terms of really looking at the gut and what's going on in there, yeah, we don't. Not that I can't, I could order it, but a lot of my patients are traditional medical patients. They're looking for things to be covered by insurance, and insurance
Yeah.
doesn't cover that.
Hmm.
So, I mean, you can do some testing, but it's pretty limited. So we really just have to go. I mean, I think you can find a lot of information about talking to a patient about their symptoms, right? I
Oh
mean,
yeah.
chronic constipation for women is like one of the most problematic common symptoms I see. And there's all sorts of just really standard, simple things we can start with, right? And
Mm.
magnesium is one of them. And it doesn't have to be magnesium glycinate. It could be magnesium citrate. It could be magnesium
Yeah.
malate and all sorts of different magnesiums. In fact, citrate might be even better for someone who really is struggling with constipation. But I also, think about, simple minerals like we're talking a lot about minerals lately, but like iodine,
Hmm.
and Dr. Lara Bryden, she's really good about talking about iodine and the estrogen connection.
Hmm.
But iodine actually helps to stabilize like kind of like the just the metabolism of estrogen, and it helps down regulate the receptor sites. So, Jamie, your breast tenderness.
Yeah.
Know this. I've used a lot of like vitamin E for breast tenderness. Works great. And anybody could take vitamin E and help their breast tenderness. It really is amazing. But I didn't know how well iodine works for that too,
Mhm.
because it down regulates those receptors. And I did a little experiment on myself using iodine for breast tenderness, and took sea kelp for a couple months and just monitored it. Breast tenderness eliminated immediately. So, that's something where, because iodine is such like essential like mineral for our thyroid,
Yeah.
I think right now we really got to be thinking about, are we getting these just essential things that
Right.
like we almost take for granted? Like we don't use iodized salt anymore. Like maybe you are a little iodine low.
Yeah.
And one capsule of sea kelp a day. There's different ways to do it. You don't want to go crazy with iodine, but I find that to really be helpful for estrogen dominance,
Yeah.
especially again, those who have the breast tenderness, and it's probably doing other good things for the thyroid as well.
So do you just take it after ovulation or the whole
You
cycle?
can, but you
Okay.
can take it the whole cycle, but the way I did it just to kind of see is I started it as soon as I ovulated, and I knew, because you know how, Jamie, it's a magical thing, right? Like
Mhm.
you could, if you have bad breast tenderness, you could almost like use that as your biomarker,
A
because it's
100%.
of a switch where you're like, my breasts are totally fine. And then the next day you're like, holy shnikes, don't
Yeah.
go near those things.
Yeah.
Um, yeah,
Totally. Yeah. Isn't that interesting that, and again, maybe more for others than some. I mean, I know for me, breast tenderness is the, if I could not see, let's say my vision was taken from me, 100% I can tell.
yeah,
Ovulation literally just happened. My progesterone levels are I'm post ovulation for sure. Now, here's the thing. If we associate, though, breast tenderness, so two questions about breast tenderness. One, I know that like after ovulation, our breasts grow a little bit because our body is starting to prepare as though we'll be pregnant. It doesn't know if conception happened or not. Our body's preparing as though it will be. So I know like our breast tissue grow after ovulation and then it kind of goes down. So if any of you have noticed like, oh wow, like my bra is a little snug, that's why. So that's like kind of a normal thing. But then there's breast tenderness that happens like a weekish before period that maybe is just more amplified or more painful. So I mean, I would say breast tenderness can be normal, right? At what point is the breast tenderness that follows ovulation, at what point does it become like a almost not a terrible red flag, like it's an emergency, but like indicative of something?
Yeah, I mean, I think at the point where it again, you're noticing it. I mean, I think subtle breast sensitivity, mild tenderness is
Yeah.
probably okay, but I don't think it should be
Like,
noticeable. Like,
oh
yeah, I
yeah.
mean, I think at the point where you're like, I can tell and I walk around in the day and I can notice my breast tenderness. Yeah, I don't think that's normal at all.
Okay, right.
Yeah. So I think it's a pretty significant symptom to kind of pay attention to because I
Mhm.
think if your inflammation is not in check and again, your hormones aren't balanced, breast tenderness is something that's probably pronounced for some people,
Yeah.
So, and I think you can really kind of, use that as a marker, right? Because
Right,
it's such an
totally.
easy thing to kind of see.
And don't you think too, like while we're talking about estrogen dominance and we start at the very beginning of the episode, like is it a red flag? Is it something to worry about? Is it this, that, the other thing? I think it's more a matter of, like for me, it's more a matter of, I wonder just what's causing my liver to be, it's working upriver. It's asking more questions now about the liver, asking more questions about the gut. It's not just necessarily about estrogen dominance. It's almost like the estrogen dominance is the symptom of maybe, again, a
Yeah.
congested liver or whatever, or a imbalanced gut, and that
Yeah.
those affect other things in our body and our systems.
100%. I mean, all hormone imbalance. Yeah. It's kind of being created by something. You're right, Jamie. It's
100%.
kind of a symptom.
Right.
That was making me think of, okay, two more things we should probably talk about
Okay.
is, you mentioned the beta-glucuronidase, right? And like
Yep.
there's a supplement that you can take to help with that process, right? So it's
Yep.
calcium deglucuronate.
Yep.
And I don't use it too much, but I'm really learning about estrogen dominance, and I might add that in. Also, DIM, which we did a whole,
Hmm.
episode on that one as well, comes
Hmm.
from cruciferous vegetables. So certainly you don't have to take a supplement. You can just load up on Brussels sprouts and broccoli sprouts and get it from food, certainly. But it is available as supplements too to help with bringing down the estrogen dominance. And the last thing I was thinking about, Jamie, too, is progesterone.
Yeah.
Like to help estrogen dominance. I mean, in some ways, you have to know what your progesterone is. And a way to combat estrogen dominance is to make sure you have really good progesterone. And
Right.
that may mean actually checking your progesterone and making sure you have adequate levels and supplementing with progesterone to kind of combat, again, that anabolic or the growing mechanism of estrogen
Right.
that it has, the building that it has to really balance and make sure it's not going too far.
Yeah, exactly. No, that's such an important thing. And earlier you had mentioned two xenoestrogens. So just to kind of start landing the plane. So we talked about how there are two ways to be estrogen dominant. I would say there's one way to be estrogen dominant and another way to be xenoestrogen dominant. So just as kind of a recap, estrogen dominance is when our estrogen levels are above our progesterone levels after ovulation, and it should not be that way. Progesterone should be dominant to estrogen, even if both hormones are low. If estrogen is higher than progesterone, we call that estrogen dominance. When estrogen dominance is taking place because of our lifestyle, plastics, things like BPA, phthalates, all these things where these molecular structures look like the hormone estrogen and try to bind to the cell receptor site that estrogen should actually go be in, but the xenoestrogen binds to it. That's called xenoestrogen dominance. I mean, that's what I'm calling it. But I mean, I think sometimes when we talk about estrogen dominance, it's really one of those two things, and they're two different things. And I'm sure they play into each other for sure. But what would you say, Teresa, like with the xenoestrogen dominance, if we know that estrogen in and of itself, biological estrogen before ovulation is good. It's really good. It's protective. We have energy. It's fertile. It's creative. It's all these really beautiful things. And then after ovulation, progesterone is high. It should be, but maybe it's a little lower. But our estrogen, biological estrogen, is higher than our progesterone. Do those xenoestrogens play a part into that estrogen dominance? Is that the reason why, not just that progesterone is low, but is it because of xenoestrogens that estrogen now kind of takes the winning piece of that race?
Probably.
Yeah.
I don't know if there's a great way to, I mean, I'm sure functional medicine has some tests that maybe can tell how loaded you are on xenoestrogens, but the problem is like we're
Yeah.
not really measuring receptor sites,
Right.
And that's, I think, the hardest thing is that I think a lot of people are talking about cellular resistance, cellular inflammation, mitochondrial issues, because at the level where you're talking about, Jamie, it's about the cell and
Right.
like how the cell is interacting with these things that float through our body. But
Mhm.
it's a really hard thing to measure what is actually going on at the cell. And
Right.
we don't have tests for that as well.
Right.
So I don't know. I mean, I think all we can do is assume that if we're not trying our best to eliminate xenoestrogens and we're like, oh gosh, I mean, I drink out of a plastic water bottle every day. I microwave plastic. I have phthalates. I put, nail polish on every day of my life. I put perfumes on. I
Mhm.
have no conscious awareness of all of these things that could be going in my body. Well, then yes, you probably have an issue if you have estrogen dominant symptoms with xenoestrogens.
Right.
And so just to take the steps to say, okay, don't freak out. Let's just see where I can make changes every day. And we've talked about ewg.org/skin deep, resources. There's tons of stuff online to help kind of remove some of these things. We'll never be able to remove all of our exposures, but we can
Right.
certainly reduce the accumulation by reducing the exposures over time.
Totally.
And like you said, Jamie, we've got to be focused on elimination.
Yep.
Elimination and detox pathways, the liver being the most important as this giant organ in our body that is meant to process things. So magnesium is so important. B vitamins, like you said, consideration for more cruciferous vegetables, sulforain, which comes from that as well. There are some supplements related to estrogen dominance, like DIM and D-glucuronate. There are, even vitamin C,
Mhm.
which helps with elimination and helps the liver support too. Really loading up on vitamin C and getting that through your food, but through supplements as well, could be really supportive to estrogen dominance as well. Am I forgetting anything? We mentioned iodine.
Yeah.
Um,
Iodine,
so a lot of things that
progesterone,
we can
supplementation.
take some to get some help with. And then progesterone, make sure you balance your progesterone and get that progesterone balanced with the estrogen. You will feel so much better.
Right.
You'll have less periods, less headaches, less bloated, less PMS, and feel like a new woman.
Yeah, exactly. And a good first step would be, ladies, if you're not charting your cycle, chart your cycle, chart your cycle. I mean, always you can look to meet with a fertility care practitioner, a fem instructor, Marquette, Sympto Pro, whatever you have. I also highly encourage you to visit fiatinstitute.com/directory where you can shop around 20 plus hormone coaches. Many of them are trained in a fertility awareness method, plus have this information that I'm sharing with you now about the liver and the gut. So again, a hormone coach is going to help you get to the root cause, try to, work with you to get to the root cause of the downriver symptoms, but also teach you about your cycle along the way. And so that's always my first step. I say, just start noticing. Just start, no even if it stresses you out to know everything about the cycle, I want you to start noticing, when are the symptoms happening? Is there a pattern? If there is, take one or two actions that seem the least overwhelming to you to help yourself move that needle. And I will say, there was a Harvard study done years ago, and they found that beyond any lifestyle adjustment or change, that somebody could do: more movement, more exercise, eating healthier. The number one improvement of someone's health was the relationships that they had, which is another reason why it's important. Sometimes we can think, well, I can find this information on my own. I can look it up online. That is true. Information is actually very cheap. But really, the true marker of, again, moving a needle is somebody to hear you. It's why, Teresa, I'm sure you have so many people that come back to you. You hear them, you see them, you help them, and that in itself is healing. So find someone you can physically work with, because when someone else can carry this with you, there is a much higher chance of, getting to that goal or helping your physical body heal.
Awesome, Jamie. Yeah, and I just had a patient that came to me that had been to one of your hormone coaches. Thank you for what you're doing with Fiat Institute. We will put all of the information in the show notes for Fiat Institute. Jamie is doing amazing work to really educate these women to help other women. I mean, it really is a beautiful ministry, and I'm grateful for it because my patients come to me and they already are taking those steps. They already are having, the body literacy that they need to have, and I can take it further then. So thanks, Jamie, for doing that. And this was a great episode, and we will see you real soon.
All right. Thanks, Teresa. Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.